I'm Linda Silas, president of the Canadian Federation of Nurses Union, and we're doing the most complicated Facebook Live we've done in the last 3.5 years. Might remember the first ones when I was just sitting in an office and one of our team members was holding my iPhone. We're doing this Facebook Live to recognize Nurses Week, to wish you all a great Nurses Week, thanking you for all your services. But we want to bring a little bit of seriousness to Nurses Week and move forward. Before I continue, I'll do a very quick lang acknowledgement, not naming all the beautiful territories on Turtle Island because we're from all over the place, but on Turtle Island, all nurses do live, work, and have fun, and we appreciate the sacrifice that has been made on these lands. La session va seulement être en anglais, mais si vous avez des questions en français, s'il vous plaît, n'hésitez pas de les écrire dans la chat box et je me ferai un plaisir de les répondre et aussi vous envoyer un message si nécessaire. The session will only be in English, but I'll make sure I can read and answer some of the English questions forward. So I'll be your moderator today, so it won't be me speaking the whole time, so that's good. We had a bright light just a few weeks ago in Canada, and I'll ask Amin to talk to us about what happened in British Columbia. Amin, please.
Thank you, Linda. BC will be the first province in all of Canada to commit to nurse-patient ratios. Needless to say, I am very excited and optimistic that we have the potential to make a difference with ratios that my fellow nurses and the patients in our care can benefit from. We know that staffing ratios alone will not solve the staffing crisis. Effective recruitment strategies as well as investments must still be made in place to provide the relief necessary to make ratios work. So it is important that the ratios create practice conditions that do address what you were saying was the safe staffing work conditions. And also it's critical to attract people to nursing and keeping them in their careers. So that retention piece that we've been talking about, it just makes sense that if we have regulations in place that protect the patients and respect nurses, then we'll have increased job satisfaction. So I am looking forward to seeing the impact that this has on our nurses in recruitment and retention strategies.
Oh, perfect. I still remember the late evening when you text me and said, guess what the press conference is going to say tomorrow. So congratulations to you, but to all your team in BC. And now there's another bright light in nursing, retention, return, and recruit. It's in Nova Scotia. So Janet, what's your premier doing?
So our government, our current premier, was elected on the promise of fixing healthcare, and he and his team has taken that very seriously. The first smart move that he made was making our Minister of Health a registered nurse. And therefore, she takes with her a lot of knowledge, and when you talk to her, she understands what you're talking about. Secondly, he promised every new grad, LPNs, RNs, and NPs, a permanent full-time job for the next 5 years, and all kinds of innovative programs like RN prescribing. So registered nurses are now able to prescribe medications in Nova Scotia, which is helping both the patients and bringing some stability to our merged departments. And lastly, just 2 weeks ago or so, this government promised, paid every regular part-time and full-time nurse $10,000 as a thank you bonus, was the words of our premier. And if a nurse decided to stay for another 2 years, they get a subsequent $10,000. So that's $20,000 that nurses are getting in our province to stay and work in our province, which is great. And lastly, he's worked with our colleges, or the Department of Health has, to streamline bringing IENs, as internationally educated nurses, into our province. And I did an interview this morning. In the last 2 days, over 9 1,000 nurses have registered with our college to get licensed. So that's encouraging, and hopefully most of them will get licensed and come and work in Nova Scotia.
And your colleagues in the Atlantic are saying, maybe home. So thanks. And you know, all the great work that Premier Whiston didn't just come because of his good heart. It came because of the work of an SNU, and it came of the work of nurses telling their stories. And if I could, I'd go back to Ontario and tell you the horror stories about what's happening, what happened with Bill 124. And if there's any nurses from Ontario listening, Ona did an amazing fight against this. We'd love to be able to clone the premiers of BC and Nova Scotia and transport them in Ontario. But hopefully we'll fix things and we'll get back to Angela here. Now I'll go to our smallest province, the cutest of all. Barb, what's happening in your province?
Well, on Prince Edward Island, we've actually been without a contract for the last 2 years. So we've been really struggling and working hard with the employer to actually get a new collective agreement. So we're happy to say that on May 3rd, we actually reached a tentative agreement. And those details have been released to our members. And we're looking forward to having that ratification vote on May 18th. So that will actually provide us at least a baseline to recruit, and also some incentives and benefits for our members that are already working at the front lines to hopefully push them through until we can get some more nurses back in the system. So what we're looking at right now is a lot of recognition for retention, and that was a big thing among our membership. So we're looking at some incentives for long service for 10 and 15 years after you've been out. We're looking at some incentives if you accept a full-time permanent guarantee. We're looking at incentives for nurses who work in 24/7 facilities. So we've increased premiums for evenings, nights, weekends, and also in designated areas where nurses work shift work. So a lot of focus on that because those are the areas that are really hard to fill, the positions that are hard to fill. And it seems that a lot of members, when they are feeling that burnout, are looking to go to Monday to Friday positions. And we still have to be very concerned about our 24/7 facilities because those patients are not going anywhere. So we need to support our nurses. So we're really looking forward, like I said, to kind of having that foundation and trying to, we have a very, I think, competitive wage now that's being proposed in the tentative agreement. And although I'm not sure if we'll keep up to Nova Scotia, we're certainly on par. And when you look at the additional incentives, we are definitely competitive.
Thank you, Barb, and congratulations. Now, Darlene, right in the middle of the country, what's happening?
Well, unfortunately, the grass in Manitoba is not nearly as green as it is in Nova Scotia, and I wish it was. We're dealing with a government that has an austerity agenda that, despite an upcoming election in October, has not really loosened the purse strings at all. They did announce retention and recruitment incentives in the fall, totaling $200 million, but they are absolutely sticking with their austerity agenda and are very tight-fisted of which nurse gets the retention bonuses, etc. I think our biggest problem in Manitoba, as it is in many other provinces, is that frontline providers are not brought to the table at all. Nurses have great solutions to some of the issues in healthcare today, and our government and our employers do not heed those at all. And a perfect example is our sexual assault nurse examiners in out of the Health Sciences Centre in Winnipeg. It was a program that was run by nurses who worked in other jobs and managed the sane duties on their off time. What we have now is a program that has basically fallen apart. We've lost 9 of our sexual assault nurse examiners. We have survivors of sexual assault and intimate violence been presenting at our department, at our emergency department at Health Sciences Centre, been asked to go home and don't shower, don't wipe after you use the washroom. For children, they've been told not to change their child's diaper, and they can come back in 8 or 16 hours when there's a nurse available to do examinations. The nurses have spoke out on that issue many, many times. They've brought solutions forward. They've been totally ignored. So as a result, we have a program that is failing. We have sexual assault survivors that are not been treated. And of course, you have to look at the whole justice part of it. Is the chains of evidence are been broken, and the perpetrators are still out there. So that's clearly a case of not bringing frontline providers to the table.
It was so nice to be at your annual meeting last week where not only nurses were tired, but the determination was there. And that's what we need to continue because nurses rock, eh, Darlie?
They certainly do,
Thanks.
all across Canada.
Yes. Now let's go to the province next door to you in beautiful Saskatchewan. Tracy?
Well, we've never seen anything as bad as it is right now in Saskatchewan. Unfortunately, we have, it's very hard in Saskatchewan to have much hope. We are almost 900 full-time positions short. Never in the history of our organization have we seen so many of our large emergency rooms going on bypass. Just a couple of weeks ago, we had 2 of our tertiary hospitals in Saskatoon, plus a hospital in Yorkton, which is regional, which is large, same with Swift Current, all go on bypass at the same time. The catchment area for the amount of people that weren't going to be able to get care, I mean, they were still able to take trauma or heart attack or stroke. That's not everything that comes into an emergency room. And this is happening because we are up to 50% short of registered nurses in those facilities. And the moral injury that our members are telling me that they are suffering every day because they are not able to give the care that they need to be giving to people. They're so fearful and so afraid that there's going to be a very tragic outcome because there just is not the registered nurses. We haven't had this kind of shortage in almost a decade in Saskatchewan. It really is scary. Our Jim Patterson Children's Hospital, there's times when, they're 300% over capacity. Families are waiting in their cars in the parking lot with very sick children, and the registered nurses don't know where to go next. There isn't enough of them to give that safe care. And, our province did make some announcements, our premier and our health ministers about, recruitment and retention. But they've hung their hat completely on recruitment of internationally educated nurses. Is that important? Yes, but it's a long-term strategy. There was absolutely nothing in this for the mid to late career registered nurses, really the people who are going to mentor the new grads. I mean, we can have turnover of 50% in our emergency rooms because people don't have mentors. They're coming into the system and there's no one to show them the way. And, we've had a lot of conversation about what to do. And as a board of directors, we've been pushing for a nursing task force. I was so pleased to hear, Dr. Buchan talk about that because we've been pushing that with Premier Moe and with Minister Merriman and Minister Hindley, that this is important. We have to hear what the registered nurses on the front line have to say. We need to immediately set up with nurse unions, nurse regulators, nurse educators. They could come to the table and help out with this. They, have some decision-making autonomy where we could move forward, where we could talk to registered nurses who have left. We could talk to the registered nurses who have reverted to casual, see what we could do to bring them back. We could talk to our retirees who, during COVID came, they helped out, with 911, contact tracing and testing. But as soon as we, made that decision that we had no longer had COVID in Saskatchewan, we let them go. We need to talk to them, bring them back, see what it would take. Registered nurses have answers. We just need to be listened to.
Yeah, great segue into going way across the country to Yvette in Newfoundland and Labrador, the first province who had a think tank side by side with the Premier. What has happened since?
So last April, we met with Premier Fury in Newfoundland and Labrador, and we brought the idea of a nursing think tank to bring all stakeholders together. So we brought together 150 stakeholders, including frontline nurses, who are the backbone and the ones who need to be heard, to tell their stories and to bring the solutions, as my colleagues here have said. They're working on the front line and they're the ones with the solutions. So once we met with those officials, we also asked for a commitment that coming out of that think tank, we would institute some of the initiatives. And we did. They were short-term initiatives. One was double time for all overtime, so that we could fill the gaps in the schedule and finally allow registered nurses, nurse practitioners to get their holidays last summer, which they hadn't had in 2 years. And it worked. People got vacation last summer. We also brought in self-scheduling guidelines. One of the biggest things we're hearing for the reasons for registered nurses, nurse practitioners, and other nursing professionals leaving permanent positions to take casual positions is because of the lack of flexibility. And self-scheduling guidelines, we worked with our Department of Health, our chief nurse, and our RHAs at the time, and came up with these guidelines. And we're trying to get those rolled out, but we're still facing resistance at the ground from managers who don't understand, that self-scheduling is just like any other scheduling. You still got to have the same number of staff on a shift as you always had. So I found myself having to get involved at times. We have a fairly collaborative relationship with our Department of Health and with our Premier. I have regular check-ins with Premier Furey, and he does ask me for solutions, and I'm very quick to give them to him. I don't hold back. And one of them is going to be money. We are the lowest paid outside of Quebec. We are the lowest paid nurses in Canada. We cannot compete with their Atlantic counterparts or anyone across this country. We are recruiting internationally. But one of the biggest things about all of these initiatives is the lack of evaluation. And we've been asking for an evaluation. It's no good to institute any initiatives unless we're evaluating them to see if they work. One of the biggest ideas we had was a travel team, a unionized travel team within the province of Newfoundland and Labrador, to fill gaps in schedules up in Labrador for a pilot project. We still haven't done any evaluation, but we do know anecdotally it is working and reducing the number of private agency nurses, because we have to stop the bleeding of registered nurses, nurse practitioners, licensed practical nurses out of the system throughout Canada and stop wasting taxpayers' money on private companies. We need to be putting money back into our publicly funded healthcare system. And I will say that our Premier agrees with me on this point every time I have a discussion with him. So I am happy to say that. And I'm also been involved and been appointed with a Health Accord Newfoundland and Labrador, which is looking at transformation of our healthcare system in a 10-year plan. And one of the biggest things of that is looking at social determinants of health, bringing back, public health nurses into school. We need our school nurses to deal with issues at the lowest level before they become bigger issues when children are teenagers and adults. And also the surgical backlog. And we're hearing that across this country. So I was also appointed as the only registered nurse with all of the orthopedic surgeons and other surgeons in the province to talk about how we tackle the surgical backlog in our province. And the number one issue is the vacancies of registered nurses. And we have over 752, which has increased from 614 last year. We're going to continue to keep pushing. We don't have a collective agreement. We are at the bargaining table. And our hope is that we are going to become competitive with a new collective agreement.
That means cha-ching, cha-ching, Premier Furey.
That means money.
Yes, it is discouraging when you hear the vacancy rates going up. When I was in PEI last summer, it was 20%. Now it's up to 26% vacancy, and we're seeing the same thing across the country. But I'll go on our second topic right away, which is privatization. The privatization is like that cancer in our healthcare system. And it is sad because a lot of premiers think it's the quick fix. And every time we start having problems in healthcare, that's what premiers do. Oh, privatize, privatize, privatize. So between Heather Smith and Pauline Worsfold, we're going to talk about the privatization of healthcare and how it impacts nurses, how it impacts patient care, and how it impacts taxpayers. So I'll start with Heather.
Well, and in terms of what's happening right now in Ontario, I have to comment on it because it's, from an Alberta perspective, it's like deja vu, a Groundhog Day, in terms of efforts by premiers who in many ways have created a crisis, and it's a prescription for privatization. You create a crisis, you underfund healthcare, you create a crisis, and then you suggest that the only viable solution is to push publicly funded activity into private markets. And certainly, we've seen that. It's the case of the zombie walks again in Alberta. We are seeing it playing out very, very rapidly. We, of course, are on the cusp of a provincial election, and healthcare is a number one concern of Albertans, because we've been down this road, and it's no yellow brick road in terms of what government office offers as a solution to a crisis. And there's no doubt Alberta, like all of the provinces here, is in crisis with regards to staffing, and again, a crisis actually that can be laid at the feet of government. But we are in a situation currently where our premier says very, vocally, and is very publicly, that she supports publicly funded healthcare. And Ralph Klein made those same comments in the Klein years, where Albertans had to fight back against a privatization agenda. The problem with our government saying they believe in publicly funded is what they're really saying is, we believe in spending public tax dollars to encourage the private for-profit entrepreneurs who want to make profits off delivering services to the public that are funded by the public. It's imperative in Ontario, as it is again in Alberta, that we never talk about publicly funded without talking about public delivery, because that is, and has been proven, is the best bang for taxpayer bucks. That's certainly the facts that defeated Ralph Klein and his third way in the Klein years. And I have to say, I'll give Pauline a chance here, Albertans weren't fooled in terms of the private activity in healthcare and the third way as the option. And I guess hopefully Albertans won't be bamboozled this time either.
Thanks. I didn't follow my notes, so I forgot my home province. And then I'll go to Adrian from BC. Paula, please, what's happening in beautiful Nouveau Brunswick on privatization? You need to stick it just to that.
Absolutely, because I could speak on a lot of things that are not happening in New Brunswick, unfortunately. But the privatization, as Heather has talked about in Alberta, and we know our colleagues in Ontario are faced with it too. We have a premier who's pushing the private for-profit agenda as well in New Brunswick, taking public taxpayer dollars and moving them into clinics outside of hospital structures and into the private entities for profit to say that they're going to do more hip and knee surgeries, they're going to do more cataract surgeries. And at the moment, it's not costing taxpayers of New Brunswick any money. But slowly down the road, what's happening is it's draining the public system. And more nurses and more healthcare providers are leaving our public system to go to these private entities. And that opens the door for our government, our Premier Higgs and his government, to say, oh, look, the public system isn't working. And the answer to this problem is to reach out to more private entities. Sadly, in New Brunswick, there's about 1,000 vacant positions for licensed practical nurses, registered nurses, and nurse practitioners. Although the regional health authorities and the nursing homes are trying very hard to recruit internationally educated nurses and those from other areas across Canada, even though we're not as fortunate as provinces such as Nova Scotia with the incentives to retain the experienced nurses. And we've been pushing from the New Brunswick Nurses Union to this Higgs government that recruitment without retention means nothing. And we need to really look at, keeping the nurses in our system, and privatization is the very last thing that we want to do. And sadly, I'll just touch on quickly that this week in the legislature with our premier out of the province and of the country, actually, many of the members of the Legislative Assembly are pushing through bills and introducing legislation in the House this week that actually takes away the autonomy of healthcare boards and our education boards, and having more control, shall I say, over what happens in our healthcare system and our education system, which are both publicly funded and publicly delivered entities right now. He is slowly stripping that away, and it's sad.
Paula, where I'm going to be there this summer, we'll shake a few cages together.
I'm up for the challenge, and I'll always push back.
It is, you progress a little bit and you think, okay, something brings you back. But there are good news out there. And it's kind of interesting that BC started with the nurse-patient ratios And now I'm going to ask Adrian to talk about the other great news that happened this spring in BC.
Thank you, Linda. Well, supporters of our universal healthcare system across the country celebrate the end of Brian Day's 14-year attack on the public healthcare system. The lawsuit was part of a concerted effort to destroy Medicare, a social program valued and supported by many Canadians. Last month's Supreme Court decision was not just a victory for patients, but a testament to the determination of those that believe in the fundamental right of all Canadians to access health care. We are very pleased that Canada's highest court affirmed the laws ensuring equitable access are not a violation of Canadians' chartered rights, and that for-profit does not reduce wait times. The prohibition on extra billing is the essential mechanism to protect Medicare. I'd also like to remind people that the role that nurses played in all this was very important. 20 years ago, it was the BC Nurses Union that began sounding the alarm over evidence of extra billing by private clinics. We successfully pressured the province to strengthen provincial legislation that would protect patients from being charged unlawful fees when accessing necessary care. With the recent win, we expect full enforcement of provincial health regulations. Dr. Day and others can no longer be permitted to ignore healthcare laws and take advantage of vulnerable patients. Now, despite the Supreme Court's decision, for-profit facilities will remain if they continue to be supported with public sector contracts. As such, we must continue to demand that all public healthcare funding be spent in the public system. Canadians should never have to choose between putting food on their table and accessing healthcare.
Thank you, Adrian. I remember that case in BC. I knew it was a nurse who got a knee surgery and proved to the courts that she had to pay out of pocket. But the experience in BC convinced Minister Duclos also to say in February a new bilateral agreements was done with the provinces, and he made it clear that the new money and the old money had to go into public services. So it's our job, this board, and your job to make sure that we keep all of them to their words and protecting our public service. One of our champions of our public health care is our very own Secretary Treasurer Pauline Worsfold, who's the chair of the Health Coalition. So I'll have her finish this off.
Well, that was very well said by the previous speakers, and thank you for introducing that. And I'll just say one thing, and it is profit doesn't care. Profit doesn't care if you are sick. Profit doesn't care about the level of patient care delivery. Profit doesn't care. But we do as nurses from coast to coast to coast. We care. And the Canadian Health Coalition, we've been on the anti-privatization, pro-public Medicare file for, well, since our inception in 1979. And one of the things that we've done over the years is research. And most recently, we've looked into extra billing. And for example, because we're in Quebec, I'm going to give a Quebec example. Carpal tunnel surgery in the private for-profit system is $908. And in the public system is $495. So profit's there to make profit. They don't care about how many nurses are in the operating room. They don't care about how many patients per nurse are on the unit. It doesn't care. So for us as leaders and the Health Coalition, Canadian Health Coalition, in collaboration with the provincial territorial health coalitions, our job is to monitor the Canada Health Act, to make sure that it's being enforced, and for provinces who are breaking the Canada Health Act to be punished by withholding of dollars. Now, on the flip side of that, our job is also to ensure that the federal government, when they increase the Canada Health transfer payments, that everything has strings attached, accountability measures, and measurable goals. That you can't be sending money to a province that they put aside to look after their deficit, or they can't put COVID money in a bank account and then give tax breaks. That's just not on. It's a waste of taxpayers' dollars, and that's what we're here at the Canadian Health Coalition to monitor. So, in closing, in Alberta, I work and live on Treaty 6 territory in Edmonton, Alberta. I'm a recovery room nurse, and there is a big election coming in May 29th in the province of Alberta, October in Manitoba. I'm going to urge every single nurse this year that has a provincial election to vote like lives depend on it. Their lives of their families, their loved ones, and their own depend on it. They need to vote for a party, a person who's going to uphold the publicly funded, publicly delivered health care that every single person in Canada deserves.
Thank you. I hope you did put some questions in the chat box, and I'll make sure that my magicians, both here in Montreal and in Ottawa, answer all your questions. Et s'il y avait des questions en français, on va pouvoir les répondre pour vous. Toutes nos excuses pour les problèmes techniques que nous avons eus, mais je vais finir notre Facebook Live là-dessus. I will finish our Facebook Live on that. It will be repeated, probably a modified version with the lapse we had in the in-between, but it will be repeated tonight. Can't remember around what time, around 6, 7 o'clock tonight on CFNU or nursesunions.ca as website. So, un gros merci. Bonne semaine des infirmières. Enjoy-vous. Make sure you have some fun, you have some rest during Nurses Week, and do know that we're going to fight like hell to fix this. Merci beaucoup.